I'm going to hand over now to Professor Carmel Hughes, Trustee here at the Dunhill Medical Trust and Chair of our Research Grants Committee. Carmel is Professor of Primary Care at the School of Pharmacy, Queen's University, Belfast. She was the first pharmacist to have been appointed to a Harkness Fellowship in Healthcare Policy, the only pharmacist to have received a Primary Care Career Scientist Award, and a former Cochrane Fellow. Her research interests centre on prescribing in older people, intervention development, and evidence-based health care. She's been a member of the United Kingdom Research Excellence Framework 2021 Subpanel 3, and we couldn't be more privileged to have her on the board. Carmel.
Thank you very much, Sue, for that really kind invitation, and it's a real pleasure to be here today, especially as this seems to be the first live event since 2019, so it's really quite an auspicious day, I think, for the Trust. As Sue says, I'm an academic pharmacist. My background is pharmacy. I also have been the very fortunate recipient of 2 grants from Dunhill, which is how I really got involved in the Trust, and I think it's a fantastic organisation, and I'm very happy to be here this morning to tell you a little bit about how the Trust makes decisions in relation to grants, and I think a lot of you are interested, based on the Slido poll, you're interested, I think, in finding out a little bit more perhaps about that mystery. So we thought perhaps that it would be helpful to give you an overview of the kinds of research that Dunhill actually funds, and it is quite broad. Obviously the main focus is on ageing, but there is quite a lot going on. As Sue mentioned, I chair the Research Grants Committee, and as the name suggests, that's the committee that oversees research grants, but we do other things as well, such as talk about broad policy that's affecting research within the health community, again particularly focused on ageing. We talk about perhaps the development of new funding streams. We talk about how we can really support researchers in what they do, and there's a big emphasis as well on capacity building and helping people to develop careers within research. And it's a really enjoyable committee on which to work, and I'd particularly like to thank Ollie and Sanjay, and particularly Gordon, in helping to get this day up and running, and particularly Gordon for the slides. So as I mentioned, in terms of what is funded, and you may have seen some of these screenshots or some of the information that is being presented on this slide in terms of what is supported and is of interest within the Trust. And everything that is done is really underpinned by the strategy. Sue mentioned that it was initially launched in 2020 and is due to run to 2025. So we're just a little bit halfway over in terms of that timeline. And in terms of the type of research that is funded, is very much along the lines of theme calls within particular topic areas. And again, I'll talk a little bit about that in a minute. The theme calls themselves will cover a range of different types of grants. So there will be proof of concept or seed funding, which perhaps might be quite a small amount of money for a short period of time, but perhaps will kickstart somebody in terms of the research. There may be larger pieces of work around research grants, feasibility studies, intervention development, and then we run a series of programmes as well around PhD studentships and postdoctoral fellowships, and some of those are also run in conjunction with other organisations. For example, the British Geriatric Society will co-fund some PhD fellowships alongside the Trust, and of course the British Geriatric Society is obviously very interested in older people. We also have some postdoc fellowships as well that are funded with the Royal National Institute for Deaf People. There's a fellowship run in collaboration with Zinc. Sue mentioned that the Trust is about to award another 25 PhD studentships to a number of institutions across the UK, and that's part of the multiple PhD studentship scheme. And I think some of you are here today are being supported through that particular scheme based on some of the posters that I saw outside. And then also some postdoctoral fellowships as well that are kick-started by the Trust, but then also we expect the institution to begin to contribute funding towards those fellowships. And everything that we fund is supported by the strategic framework, and again you can find more details about that framework on the website. But this is the kind of thing, so over on it's your right, I guess, it's my left, the kinds of things that are being supported around the ageing immune system, social determinants of health, etc. So it gives you a flavour of the kinds of things that are currently being supported by the Trust. As well as being very interested in scientific quality, scientific rigour, we also have a number of underlying funding principles as well that really do guide us in terms of the decisions that we make. I think not just in terms of research, but I think really in terms of the way in which the Trust actually operates. Sue has already mentioned some of these already around involving people and getting them engaged in research, but that just doesn't apply to researchers. It also applies to those who will be the ultimate recipients of the benefits of research, and that is the end user, and particularly from the Trust point of view, it relates to older people. And we really do want our researchers who are supported by the Trust to engage with older people and to talk to them about the research, and if at all possible involve them in the research, not just in terms of being a participant, but being someone who is involved perhaps in the development of the research question, in commenting perhaps on the data that are being collected, in the analysis of the data, the whole concept of patient and public involvement. And that is something that is very close to the heart of Dunhill, but indeed many funders as well. Sue has talked already about making connections and convening networks, and of course that's why many of you are here today. And we know that research really is not, I think, a solitary occupation anymore. It does take good teams, appropriately multidisciplinary teams that are going to help answer the really big questions that are facing society at the minute. I've already mentioned the issue about multidisciplinarity, and of course that links back to having appropriate networks. And I would imagine that within the labs or the centres in which you are working, it's not just a single discipline that is working within that unit. And I can speak from my own experience as a researcher who has involved sociologists, anthropologists, statisticians, economists, health services researchers to try and help answer questions that we are posing in relation to healthcare. Equality and diversity, again, I think is a really important and underpinning principle, and it speaks I think, to the individuals who are undertaking the research. So we really want to tap into the best talent right across the researcher community. But I think it also speaks as well to the research that is being conducted, and that we are considering equality and diversity amongst those who are taking part in the research as well. So we're just not dealing with one particular small population. In some cases that might be entirely appropriate depending on the research that's been done, but we need to think about the broader society and the broader needs of society. And although the Trust is very much driven by a particular strategic framework and that we are working within certain subject areas, they are flexible as well and will respond as and when required. And I think that probably came to the fore no better than during the start of COVID, where Dunhill were really first, I think, out of the marks in terms of supporting researchers as they were faced with this pandemic, which meant that they couldn't get into labs, they weren't able to finish off their work. And I think the Trust has just been absolutely outstanding in terms of supporting the researcher community. I was one of the lucky people, again, who had some support as a result of the impact of COVID on a project that we were finishing off at the time. I thought it would be helpful to talk a little bit about the application and review process. And again, I think this is a little bit about the lifting the veil around some of the mystery associated with submitting applications and then the review process as well. There are a number of different ways in which this is done, and it does depend to some extent on the call. The calls will be issued at certain times of the year, and again, they will very much link back to the key themes and the areas that we are interested in. The calls will be informed by the strategic priorities. The calls will also be refined by discussion within the Research Grants Committee, as well as liaising with some of our key stakeholders. And we will advertise the calls through a number of different sources, such as the web itself, LinkedIn or Twitter, etc. And sometimes the calls can be a one-stage call or a two-stage call. With a one-stage call, essentially, the application is completed by the researcher, is submitted to the Trust, and the review process then basically starts from there. They will be checked in terms of eligibility, so depending on the requirements of the call is what is being submitted and who is submitting it. Are they actually eligible to apply? It will be subjected to external peer review. Very often the outcome of that peer review will be shared with the researchers, and they will be sent details and comments from the peer reviewers and given an opportunity to respond to that. Then the grant will be reviewed by a panel, and that panel will consist of members of the Research Grants Committee along with external panellists, and those external panellists will change depending on the nature of the call, and it very much will be discipline specific. Sometimes we will undertake interviews depending on the nature of the application. So for example, in relation to a fellowship, very often we are interviewing people for those fellowships, and then a decision will be made in terms of it being funded or not. Two-stage process is slightly more protracted in that it's carried out, as the name would suggest, over 2 stages with an initial expression of interest. It is then checked internally by a trust staff. It will then be scored on a number of different criteria, and then successful applications will be invited then to submit a full application, and that will be stage 2. On completion of stage 2, those applications will be submitted by the researchers. Again, there will be another eligibility check just to make sure that everything is as it should be. It'll be sent out again for external peer review, and those peer reviewers very often are drawn from international research communities or national as well. Again, feedback will be given to the applicants in terms of what the peer reviewers have picked up on. And then the panel, which again consists of members of the Research Grants Committee, an external panellist will review everything that has been submitted by the applicant along with the peer reviews that have come from outside the Trust, along with the response that the researchers have given to the comments that have come from the peer reviewers. Again, if it's a fellowship, those who have applied will be interviewed, and then a decision will be made. The timeline can vary depending on the nature of the call that has been issued. On the far side of the slide, that outlines a particular call that from launch to final decision was about 9 months. And that's not unusual in terms of funding decisions, and many funding bodies will operate to that time scale, but again, it may take a few months after that to finalise contract details, etc. So sometimes projects don't start for perhaps 12 months or 15 months after initial application. A little bit about what we look for in terms of scoring. So I mentioned that applications will be sent out to external peer reviewers, and we're asking them to comment on the quality of the proposed work, the methodology and the feasibility of doing that work, and then the research team and the environment. So all of those are really important factors, and some things I think that people really focus on within the application itself. So what is the overall quality? Does the methodology make sense? And will they be able to do the work that they claim they want to do based on the time and the funding that they have requested? Is there an adequate team to be able to do that work? And does the environment support it as well? So the comments coming back from peer reviewers will be sent out to researchers to respond to. For people then who are involved in the Research Grants Committee, which will include the Grants Committee itself and the external panellists, they're also scoring quality, methodology, team and environment along with these other criteria that are listed here. They're looking at dissemination and impact. They're looking at equity, diversity and inclusion, patient care and public involvement, which I mentioned earlier on, capacity building, career development support, and also the funds requested. So all of these will be examined in terms of whether or not this is an application that is going to be worthy of funding from the Trust. The other thing that we'll look at as well is any risks that the researchers will have identified that may in some way affect the ability for them to finish that particular piece of work. So it's important that they do identify risks and how they're going to manage those risks over the course of the project itself. And all of this is being considered as part of the review process. So it really is quite involved in terms of the level of scrutiny that grants will receive from peer reviewers, from panel members, and then the panel meeting itself where all of this material is brought together will involve a discussion about what has been submitted, the response to reviewers, and the panelists review themselves. And you'll have an opportunity this morning to participate in a mock committee meeting, so you'll be able to pass judgment on a couple of applications that have come in to the Trust, and to decide whether or not this is something, these grants would be something that you would fund perhaps with some conditions, or not fund. Just a couple of things as well in relation to the principles of peer review. The Dunhill Medical Trust is a member of the AMRC, and it has certain expectations around the way in which peer review is going to be conducted. So we have to be accountable for what we do. There has to be balance within the panel in terms of the types of disciplines that sit on those panels, and they need to be appropriate to the call that has been made. They have to be seen to be independent of decision making, so the employees of the Trust do not make decisions in terms of what is being funded. That is up to the Grants Committee. It's also important as well that the committee is refreshed, and people are not sitting on the committee for 10, 12 years. They do are members of committees for a fixed period of time. And it is important that we are entirely impartial in terms of the decisions that we make, and it's very important as well that we will declare any conflicts that we have. So that applies to us as committee members. Have we any relationship at all with any of the applicants in terms of being in the same institution or the same research group? That is also the case as well with peer reviewers, and we'll always check for conflicts of interest to ensure that we can stand over the decisions that we made, and that those decisions have been entirely impartial and objective and are based on the quality of the work that has come in. So